Rapid review for key associations. Mitochondrial inheritance disease associated with disease occurs in both males and females and inherited through females only. Intellectual disability, Down syndrome, Fragile X syndrome is the associated disease. Vitamin deficiency in the US is folate. Pregnant women are at high risk. Body stores only 3 to 4 months supply and prevents neural tube defects if you take folic acid or folate. Lysosomal storage disease is associated with Gaucher's disease. Bacterial meningitis, adults and elderly. Streptococcus pneumoniae is the most associated bacteria. Bacterial meningitis, newborns and kids, associated with Group B, Streptococcus, E. coli, Listeria monocytogenes for newborns, S. pneumoniae and N. meningitidis for kids and teens. HLA-DR3, this is human leukocyte antigen death receptor 3, associated with diabetes mellitus type 1, SLE, Graves' disease, Hashimoto thyroiditis, also associated with HLA-DR5. Addison's disease is also associated with findings in the HLA-DR3. HLA-DR4, human leukocyte antigen death receptor 4, is associated with diabetes mellitus type 1, rheumatoid arthritis, Addison disease. Bacteria associated with gastritis, peptic ulcer disease, and gastric malignancies, example adenocarcinoma and maltoma, is associated with H. pylori. Opportunistic infection in AIDS is associated with a pneumocystis jirovecii or carinii pneumonia. Helminth infection is associated with Enterobius vermicularis. This is the most common involved parasite, Enterobius vermicularis. Viral encephalitis affecting temporal lobe, HSV1. Infection secondary to blood transfusion, most commonly associated with hepatitis C. Food poisoning, exotoxin mediated, is associated most commonly to S. aureus or B. cereus, Bacillus cereus. Osteomyelitis is associated with S. staphylococcus aureus. This is the most common. Osteomyelitis in sickle cell disease is associated with Salmonella. Salmonella is the most common cause. Osteomyelitis with IV drug use, the most common cause is Pseudomonas, Candida, and Staphylococcus aureus. UTI, most commonly caused by E. coli, Staphylococcus saprophyticus for young women. Sexually transmitted infection or disease is most commonly caused by C. trachomatis, usually co-infected with Neisseria gonorrhea. Nosocomial pneumonia is commonly caused by S. aureus, Pseudomonas, other enteric gram-negative rods. Pelvic inflammatory disease is commonly caused by C. trachomatis and N. gonorrhea. Infection in chronic granulomatous disease is commonly caused by S. aureus, E. coli, Aspergillus, that is a catalase positive. Metastasis to bone is commonly in the prostate, breast, sourced by prostate or breast, and then followed by kidney, thyroid, and lung. So this is the primary cancer, and it metastasizes to bone, but most commonly the source of primary cancer is the prostate, and it will metastasize to the bone, followed by the breast, then metastasize to bone. Metastasis to brain, the source is, the primary is the lung cancer, followed by the breast cancer, melanoma, colon, and kidney cancer. So lung is the most common metastasis to brain, that will metastasize to brain. Metastasis to liver, Common source is the colon, then the stomach cancer, then the pancreas. So colon cancer is the most common cause that will metastasize to liver. S3 heart sound is the common finding is increased ventricular filling pressure, example mitral regurgitation or heart failure, common in dilated ventricles. S3 heart sound is commonly heard in the dilated ventricles and increased ventricular filling pressure, secondary to mitral regurgitation or heart failure. S4 heart sound, that is caused by stiff or hypertrophic ventricle because of aortic stenosis, restrictive cardiomyopathy. So you can hear S4 heart sound. Constructive pericarditis in TB, that is in developing world. So this is the most common cause of constructive pericarditis in the developing world, TB. Idiopathic viral illness, which is a common cause in the developed world, on the first world country. For the constructive pericarditis, for the first world country, cause is viral illness, but for the third world country, developing world, is the TB. Holosystolic murmur, ventricular septal defect is most common source, tricuspid regurgitation and mitral regurgitation. So that is for holosystolic murmur. Ejection click, aortic stenosis. Mitral valve stenosis is caused by rheumatic heart disease. Opening snap, mitral stenosis. Heart murmur or a congenital, that is mitral valve prolapse, most common cause. Chronic arrhythmia, atrial fibrillation associated with high risk of emboli. Chronic arrhythmia. Cyanosis, early, less common, is tetralogy of Fallot, transposition of great vessels. So tetralogy of Fallot is the most common cause of cyanosis, early cyanosis. Troncus arteriosus is also a common cause. Total anomalous pulmonary venous return and tricuspid atresia. Late cyanotic shunt, uncorrected left to right becomes right to left. Eisenmenger syndrome is the cause of late cyanotic shunt, late cyanosis, caused maybe by ASD or atrial septal defect, VSD, or the PDA, patent ductus arteriosus, results in pulmonary hypertension or polycythemia. So Eisenmenger syndrome is the uncorrected left to right becomes right to left, will lead to Eisenmenger syndrome. Congenital cardiac anomaly, most common is VSD. Hypertension, secondary, most common cause is renal artery stenosis. Chronic kidney disease, example of the chronic kidney disease from polycystic kidney disease and diabetic nephropathy. Then we have also hyperaldosteronism, most common cause of hypertension, secondary hypertension. Aortic aneurysm, thoracic aortic aneurysm, caused by Marfan syndrome, most common. Idiopathic cystic medial degeneration is a Marfan syndrome. Aortic aneurysm in the abdomen is caused by atherosclerosis. Smoking is a major risk factor. So for all smokers that have the abdominal aortic aneurysm, so that would be the atherosclerosis is the main etiology. Aortic aneurysm and the ascending or arch aorta, ascending aorta or the arch of the aorta, the tertiary syphilis is the most commonly associated cause, that is syphilitic aortitis, vasa vasorum destruction. Sites of atherosclerosis, commonly first is in the abdominal aorta, followed by coronary artery, popliteal artery, and carotid artery. That is the most common sites of atherosclerosis. Aortic dissection, most common in hypertension. Right heart failure due to pulmonary cause is cor pulmonale is the most associated cause. Heart valve in bacterial endocarditis is commonly caused by a mitral valve, then the aortic for rheumatic fever, and the tricuspid for IV drug abuse. So that is most commonly associated cause for the heart valve in bacterial endocarditis. Mitral, aortic, then tricuspid valve. Endocarditis presentation associated with bacterium. Staphylococcus aureus is the most commonly associated etiology. Acute IVDA tricuspid valve. Veridans streptococci for subacute dental procedure. So Veridans streptococci is for subacute. S. bovis for the colon cancer, and culture negative Coxella bartonella and Hyssec. This is the most common etiology for the endocarditis presentation associated with bacteria. Let's go to part 2.